offices, and living rooms. But remember, we only ship within the USA and Canada after shipping cost is paid. Call Jasper Designs on 1-306-203-2650 or email us at doduyayra@gmail.com. Follow us on Instagram at Jasper Love or follow Pearl Yara Agboka on Facebook. Don't be left out. Please place your orders now.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Good evening to all and welcome to the health segment on Trend Africa TV. My name is Dr. Araba Cromwell. I am a family nurse practitioner and your host for today's program entitled The Health Talks. This evening we'll be discussing the community health and we'll also be speaking about a clinic that's going to be opening up soon to benefit us all. We are joined in the studio by Dr. Prince Hodogbey, and he's going to be giving us all the information about this wonderful initiative by Ghana National Council and Ghana House Incorporated. Let me give you a couple minutes to go ahead and share the feed. Tell a friend to tell a friend that Dr. Araba is on. This is Health Talks. We'll be right back.
Looking for that special gift for that special someone? Looking to bring life into your personal or family portraits? Art Bank is your creative bank of art solutions. We provide a wide range of digital photo editing and paintings that will transform your images into exquisite yet affordable pieces of art. We bring old photos back to life. Your photos can be framed or made into canvas prints of any size of your choice. Our ultimate goal is to bring into your homes and offices amazing masterpieces through eye-catching portrait paintings for occasions such as birthdays, graduations, award ceremonies, funerals, and many more. You can locate us on Instagram at @bankgh. You can also contact us on 312-609-9907 or @bankgh@gmail.com for all your inquiries. Art Bank, reviving your images.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining us, and for everyone who has just joined us, welcome to the health segment on Trend Africa TV entitled Health Talks. My name is Dr. Araba. Health Talks is brought to us proudly by Trend Africa TV, Ghana National Council, and our sponsors are the Jemima Nunu Foundation, Omama TV, Holiday Africa, and POD Ventures. Community health is essential, a very essential element of health reform that looks to lower national healthcare expenses. Community health providers operate under a patient-centered care model involving patients in all care decisions. This model allows for providers to steer patients away from costly trips to the emergency room, and it also helps to avoid relapses. Our goal as healthcare providers in the Chicagoland area is to change the model of care from treating illnesses to rather maintaining wellness. This challenge is comprehensively and it's going to address patients' well-being, not just putting a Band-Aid over elements that will soon resurface without proper preventative or maintenance care. So that is our goal. And who's going to be here to tell us all about this is none other than our guest for this evening, which is Dr. Prince Hodogbey. Dr. Prince Hodogbey is a board-certified physician in family practice and family medicine specialist. He lives in Romeoville, but works mainly in Joliet, Illinois, and also throughout the city. Dr. Hodogbey usually is the initial points of contact for patients looking for general or primary medical treatment, and also can direct patients to specialists when necessary. As a family doctor in Illinois, Dr. Prince Hodogbey offers complete health care for individuals and families. He is an expert and diagnoses, treats, and manages a wide range of diseases, illnesses, and conditions. Dr. Prince is dedicated to preventative medicine and the well-being of the Ghanaian community at large. He selflessly volunteers his time to see patients at GNC's Health and Wellness Expos, and he is an active member of the Ewe community. And he is our guest this evening. So, Dr. Hodogbey, you are more than welcome to the show. Thank you so much for accepting our invitation. How are you?
I am doing very well. How are you?
Very well. Thank you.
Thank you for having me.
Of course. Thank you. We're going to go ahead and jump right in. I always like for our viewers that are watching us to kind of get to know the people who we are interviewing. We at Trend Africa TV and Ghana National Council make it our effort to bring the best of the best out. So for people who do not know Dr. Hodogbey, we're going to learn a lot about him. And also he's going to tell us about the health clinic and the initiative that Ghana National Council and Ghana House Incorporated is trying to bring to the city. So a lot of things to talk about. So we'll dig in. So Dr. Prince, what made you choose medicine?
That is a very good question, and it's a very long story, but I will make it short. Growing up, I grew up in Ghana, in a village called Dofo Adidome, just about 10 miles south of Joapon. Those of you who know Ghana, Joapon is the first time you see when you cross the Adomi Bridge, going to the Volta region. And I come from a village about 10 miles south of that place. Growing up, even though the main trunk of road from Accra to the Volta region, going to the northern part of the Volta region, is through Joapon, which is only about 10 miles or so from my village. The village was very inaccessible at the time that I was growing up. Now it's very accessible, but when I was growing up, it was very inaccessible. So the closest hospital to us, even though they were not too far away, you have to do a lot of work in terms of getting somebody who is sick from the village to any hospital or health post. When I was younger, we did not have any health post, but at around age 7 or 8, we had a health post in the village. And my interest developed in medicine because of all the illnesses that I was witnessing. Some of them simple things are now to me, but then everything looked very big because somebody got sick. There was not much in terms of provision of care to that person. Some people die, some people just giving birth die from childbirth. Mother will pass away, child may survive, mother will pass away. And all those things led me into thinking about, okay, what can I do to help this situation? So I developed quickly my interest in science at that time in school, and I tried to work as hard as possible to get as far as I could get. And primary school, middle school, I did from 3 and then went to science school in Maoli school. Maoli school, those of us who know as Maolians, we are quite loud and loud for good purpose because we think we are that good. In the Volta region, you are not going to call one school before you call Maoli school as a school. So my interest quickly developed in healthcare, in medicine. Went to Maoli school, studied physics, chemistry, biology at the sixth form, and then after sixth form, I came here. So the short answer to the question is that it was due to my upbringing and the environment in which I grew up that turned me into somebody who wanted to get into this field and help.
Thank you. And you spoke about how you saw a lot of different illnesses and it drove you to go into medicine. So then what is the motivation that drove you to your current specialty, which is family practice?
The motivation is and was still the same. I was one of the few people who decided on doing family medicine even before I got into medical school. Reason being that I learned very quickly that family medicine is general medicine, as it is called elsewhere. You see everything. You see the child. I literally see a newborn, see the mother, and see the grandmother in the same day. So that's how broad family medicine is. So because of the broad nature of the field and how I grew up, I thought that would give me the best leverage in terms of helping in the community in which I grew up, even though I'm not practicing in that community now. But our problems here, for the most part, are not that much different from where I grew up. So because of the broad nature of the field, that is what interested me to get into it.
And you mentioned that you've always liked sciences. So did you start your medical training back home before you came here to complete it? Or did you do everything here?
No, I actually I study science because if those of you who know the old system, now things have changed. So the old system in Ghana, where we have the Form 5 and then the lower system, upper system, that's the system I went through. I don't want to sound too old, but that's the system I went through. Form 1, Form 2, Form 3, everybody studied everything. And then when you get to between Form 3 and Form 4, you have to branch into the arts, the liberal arts, business, or science. So I did everything at between Form 3 and going to Form 4. I decided to go into science. I was doing well in all subjects, especially the science that interested me more. So I was doing well in everything, and then got accepted into science. And it's, even though you don't write an external exam to get into science in Mali school, it was very competitive. So the selection process was that keen, and I was accepted into science. I studied biology, physics, chemistry, additional maths at that time, modern maths, economics and geography at the O level, and then English language, and then passed at the O level, and then got into the A level, where I studied physics, chemistry, and biology. So it was just after my graduation from sixth form and after national service when I moved into the United States. So I did my college work and then my medical work in the United States.
Okay, and then what school did you attend here for your medical training?
I went undergraduate. I studied at the University of Illinois at Chicago, and my medical school work also I studied at the same school, University of Illinois at Chicago. So I spent 8 long years at the Chicago near West Side, and it wasn't fun, but I think it's paying off now. But it wasn't fun then.
Yes. And there are a lot of people who watch our program and they get motivation from the different providers and doctors that we bring on. So what is the advice that you would give someone who's watching? Let's say there's a new college student or just someone who graduated high school and they're thinking about medicine. What motivation would you give them in order to continue their career?
What I tell all my mentees, I have a few of them, and some of them are still in med school. Some of them are doing residency now. Some of them are practicing now. So we are colleagues at this point. What I tell all of them is that the field is very rewarding, but you have to put in a lot of work. You have to be very dedicated to be able to get through. Anybody who tells anyone that it is easy, that person hasn't done enough. It is not easy. I thought I was quite smart until I got into medical school when I realized that, okay, maybe the smartness alone is not enough. You have to go and do more than just being smart to be able to get from point A to point B, because the first and second year, the workload by itself that they dump on you every day to get through before you go. But the next day and get more was very, very challenging. But especially those of us who had our part of our education outside the US system, it was a bit challenging, but we quickly caught up with what we needed to do to be able to move on. So the short answer to your question is that it is a very rewarding field in terms of how much you want to do, because almost all of us who go into it with the mindset of helping people, and that should not be lost. If that is lost, then you have lost your aim. That should always be there, but there will be challenges that will come your way that will make you rethink whether you really want to be helping people or not. That thought should not go away. So hard work, perseverance. At some point in my apartment when I was in medical school, I put them, failure is not an option, and I still believe in that. You really have to believe it's not an option to be able to get from the first year to the fourth year. It gets better as you climb, but it is very, very challenging. This is not to discourage anybody, but those who know me quite well, I am as blunt as it gets. I don't sugarcoat anything. It is doable, but it takes a lot of dedication, hard work, and support. Support from anywhere that you can get it from. Sometimes the support means that somebody that you can just vent or can just confide into to help you through the process. So I will encourage anyone who is listening to us now, if you have any questions, you can contact me after this program. You can get my number from Dr. Cromwell, and she will link you up with me. We talk more about people who are interested and are on the fence whether to go into it or not.
Absolutely, and thank you. And that is very powerful. Failure is not an option. And that is a great segue to bring us to our next set of questions, which is just going to be questions about family practice. I think that when we talk to a lot of different providers, it's very important for our viewers to understand the role of every provider, right? Everybody has a different role in the healthcare spectrum. And that is the reason why we take our time and we bring different specialists and we bring people so people can understand how the whole spectrum works. So as a family practice provider, Dr. Prince, how often do you recommend that people see their primary care provider?
Okay, that has a very short answer and a very long one. I'll start with the short one first. On the surface, everybody, even from a young person to an adult, because as a family practitioner, I see everybody. At the minimum, everyone needs to see the doctor at least once a year, at the minimum, not more than that. That means that the healthy people who don't have anything, the young guy who goes into the gym every day and lifts weights and run around and everything, everyone needs to see the primary care person at least once a year. Those people who do kids, obviously when the child is born and things like that, because of vaccination things, we have frequent visits. So this is a general statement. And then it gets to the specifics. If you see a primary care person and then you have a problem, let's say pre-diabetes or diabetes, high blood pressure, high cholesterol, okay, then the 1 year thing doesn't work anymore. So depending on how serious the problem is, your doctor is going to structure the visit. If you come to see me and your blood pressure is off the chart, even telling you to come back and see me in a month is not adequate. You may start your medication and then maybe follow up in a week or two, depending on how the problem is. And then we start working things from there. If things become stable, then chronic problems, 3 months visit is advisable. If things are not stable, you are going to work with your physician, depending on timing and everything, even though We have things written on paper. Yes, the person has to work also, and some people don't have the time to come. Work with your provider, and then you can schedule things that are adequate for you. So the short answer is at least once a year. The long answer is that it varies depending on what problems you have. If you are, somebody tells you, because our patients who have pre-diabetes, they were told 2 years ago, didn't show up again, they come in and they have diabetes so bad that even medication by mouth will not solve the problem. So if somebody tells you you have pre-diabetes, then within not more than 6 months, check that again, see where things are. And the short answer, as I said, at least once a year. The longer answer depends on what else is found when you go for the first visit.
Excellent. And that brings us to our next question, which you kind of answered a little bit when you gave the example about the diabetic person, pre-diabetic person who comes back too late, and now the diabetes is out of control where they can't take medication. So that general statement, right, brings us to preventative medicine. So tell us, apart from the example you just gave us, why is preventative medicine so important?
Preventative medicine is very, very important because of what it does. What preventative medicine does is to just use the word. I don't like using the same word defining the word, but it is simple enough and it will be more understandable when we do it that way. It is supposed to prevent you from developing chronic diseases. That is because it's based on 3 different broad areas. We are going to focus on the first broad area here. I think the second and the third one we will leave behind. But it is supposed to help you not develop resistance, because as most people or some people listening to us may know, the chronic diseases, most of them are not curable. Yeah. We can manage them, but we cannot cure them. So it is better for us to prevent them so that they don't develop in the first place than to develop them and then trying to get rid of them. Because some patients come in and say, oh, can I get rid of this? The answer is maybe, but for the most part, maybe not. So that is what preventive medicine does to us. We do things to allow us not to develop chronic illnesses. So in broad definition, that is preventive medicine.
Okay, and you spoke a little bit about the frequency as to how people should come and see their primary care provider. So it's yearly or contingent on whatever disease they have or any kind of condition, and then you would break it down. So just in general, for people who are watching, a lot of people don't understand even the screening process of some adults. So let's talk a little bit about some screening that certain adults need at different ages and why it is so important for them to come in for their visit.
Okay, we'll talk about the general ones first, and then we go to the cancer ones later on. Cancer puts everybody to everybody's has to race faster than normal. So we'll discuss the general ones first, and then we get to the cancer ones later on. So general ones, I mentioned some of them already. High blood pressure, hypertension, home they call it BP, diabetes, high cholesterol, and then some of the infectious diseases depending on age and then what you are doing. In this country, hepatitis C is recommended, HIV is recommended to be screened for, and then we get to the nuances of whether or not we need to screen somebody, because the recommendations are quite a bit, sometimes a bit rigid, depending on where you are reading. But those ones that I mentioned, especially for people who have weight problem or who have family history, those ones need to be screened regularly, especially from age 30 and up, sometimes 25 and up, depending on health situation and family history. So the once a year is true for the high blood pressure, diabetes, hypertension. If nothing is found, you don't assume that, oh, I'm going to stay for 5 years before I go back again. Next year, do your annual visit. Those things are going to be checked, and they will tell you, okay, you are good for another year again. The following year, do the same thing. Eventually, nothing is going to be found. That is what we want. That's good for everybody. But sometimes things are found, and depending on what is found, we work on it with scheduling and then follow up and things like that. And now we get to the heart-racing ones, that's the cancer and stuff like that. For ladies, young ladies after 21, it's recommended to have a cervical cancer screening from 21 and up. Now the recommendation is to, if you do one and it is good, 3 to 5 years is recommended to do it again. Formerly, we were doing it every year, but it's been found that from so much meta-analysis of data has shown that there's not much health benefit in doing it more frequently than every 3 to 5 years. But when something is found, this is the same thing. Medicine is easy when nothing is found. Medicine becomes very complicated when things are found. When something is found from the screening, depending on what is found, then you may have to do some procedures, or you may have to follow up in 6 months and do it, and then do it for every year for at least 2 to 3 times if everything is normal before you go back into the pool of screening again. That means 3 to 5 years. So that's cervical cancer screening. For women, I'll deal with the women and then come to the men. The men, we are very simple. There are not too many things, but there are some commonalities, and I'll work those in. And then by age 40, now depending on the specialty, people are moving it to 50, but we are still doing it from age 40. Breast cancer screening. Every year, that is done every year. There's no ifs or buts about that one. Every year, you do that. If it is good, then it's good. Come back and then we do it again the following year. So it is recommended that from age 40, breast cancer is screened every year until about age 65, 70. Then you stop, depending on what screening method you are looking at. And then the same thing, if nothing is found, and the ladies who are listening, sometimes it's very frustrating because I get calls from a lot of ladies. I did this, and they say, oh, this is that. They want me to come back and do it again. Yes, because the first one is a screening one. If something is found that the screening one was not able to tell correctly whether it's good or bad, then they will request for you to do a diagnostic in addition to ultrasound. And then that will, for the most part, about 90-95% of the time, will tell if they need to do any more testing or not. For about most of the time, the diagnostic one says there's nothing there. That's good news for everybody. And then sometimes the diagnostic one and the ultrasound will still not be very definite as to what is there. And then that comes in, the sometimes biopsy. Biopsy is literally going into the breast to take a tissue, take a look at it under the microscope and see what is happening, because cancer is just a cell that is multiplying out of the regular multiplication process. So if they see that and then there's no changes, then you are good. For another year, they tell you, okay, you can go back and do the routine screening. And then still on the ladies, at age 65, it is recommended to do the screening for osteoporosis. This one is kind of iffy for men. Some of the professional organizations tell you to do it for men at 70. The data is not very clear on from some of the professional organizations whether or not we should do it for men at all. But for women, it's recommended that Density screening is done for osteoporosis from age 65. And osteoporosis is the thinning of the bone. So if they find something that is not, that is showing that your bone is thinning, there are medications to put you on to actually make the bone not to be too brittle to break at any time. And then for everyone, man or woman, colon cancer screening is recommended. It used to start from age 50, 50, but things are changing now, and they are dropping the age. Actually, we have started screening from age 45 now for everybody, because the data is showing that we are finding younger people in their 40s, who are developing aggressive forms of colon cancer. So for now, it is recommended to start the screening from age 45 and up. And the same thing applies for every screening, the same thing. There are so many forms of screening for colon cancer, we don't have to go into the details. But when something is found, things are going to be done to see if you have to fall into the normal screening process or not. Depending on the test that is used, if the stool test, usually you have to do that every year. There are tests that when they are negative, you do that every 3 years or 5 years. And then the gold standard for screening is colonoscopy, but that is quite invasive. So it is a lot of institutions are moving away from that now, and it's also costly. A lot of institutions are moving away from it and doing other things first, so that when those things test positive, and then they move the people who test positive to the colonoscopy. But if you happen to use the colonoscopy for screening and everything is good, you have a whole 10 years before you do it again. So that's a good thing about it. So that is the screening for colon cancer. That's everybody, man and woman. And then prostate cancer at this point is quite nebulous. It's not very clear whether we have to be screening the general population for prostate cancer or not. I have patients, a lot of patients, come in 40 years old, 35 years old. The guy, the first thing he's interested in is, I want to screen for prostate cancer. And sometimes you have to take a lot of time to explain that the general screening is not recommended at this time because the data doesn't show much. But if there's a family history, a father who had prostate cancer, or a brother, actually the data shows that if my brother has prostate cancer, I am more likely to have prostate cancer than if my father has prostate cancer. So, but if those are in the family, especially when they are younger, meaning that it happens between age 50 and 65, then it is recommended that at the earliest age that the person who has the cancer is diagnosed, 10 years from now, you start screening for prostate cancer in the person who is asking you. And this statement is generally true for all cancers. That if there's a cancer in the family, the younger person who has a cancer, let's say the youngest person has a cancer at 50, no matter what the cancer is good to be not. I shouldn't say no matter what the cancer is, because there are some cancers that we know what the causes are, so it's not everybody. The ones that run in the family. If the person who has a cancer is about age 50, then you start screening the rest of the family members from age 40 to be able to get them in place. And then I spoke about the STDs, chlamydia, gonorrhea, trichomonas, that's recommended for the teens and young adults, at least on yearly basis. And then Um, what else? HIV is recommended for now. HIV screening is recommended for between age 15 and 65. Recommended to screen for that once a year. And then hepatitis C is also recommended to be screened for at least once in the person's lifetime, beginning from age 18. So those are some of the common screening things that we need. I know I've taken a long time to answer this one, but there's more to this than what I'm saying. But those are the things that we need to be screening for regularly. And then there are some specific ones, like somebody who smokes, a person has been smoking for a long time, and then there's anything like cough and things like that. The general screening is not recommended. So you have to listen to the person's history, family included, and then the habit part of smoking. If that is also in place, then somebody comes to you, middle age or even older or younger, if they have been smoking for a long time, because some people start smoking at age 11 or 12. Don't ask me why. I don't know why they do it, but people do it. And somebody who has been smoking for a long time coming to you with cough, especially multiple occasions, and nothing's going away, you treat it and nothing's going away. That should guide you towards at least doing a chest X-ray first, and they tell you something, and then there's a specialty for screening for lung cancer in people who are predisposed in terms of habit and family history.
And I think one thing I was just going to add to the colon cancer screening, the colonoscopy, is that it's diagnostic and also treatable, because if there's any polyps, they will remove it. And I think that is the reason why, with a lot of younger, especially younger African Americans who are being diagnosed with colon cancer, very aggressive colon cancers at a very younger age, as you said, that is the thing to it. The reason why you get it is so if there's anything, they can remove those polyps and then be able to test it and help you to not develop such a invasive cancer where they're not able to do anything about it. So very, very important. Also, I want everybody I want to reiterate about the 10 years before. Very, very important. A lot of us don't really know our family history, but it's worthwhile to ask your parents or ask your aunts and uncles if anyone has any type of cancer in the family, so you can get screened that 10 years ahead and possibly save yourself from going through that. So very, very important about the screening. And as Dr. Prince said, there's so much more to screening, but what was shared today is very imperative information. I hope that everyone listened attentively. And of course, if you ever have any questions or concerns after the show, we are more than happy to help you. That is what we are here for. So we talked a lot about all the different things that can happen. So in general, what is the best way to just prevent disease? Just in general, what are some things that we can all be doing to prevent ourselves? I mean, some things are genetic, but what can we all be doing to help us prevent some diseases?
Okay, very good question. The first thing is what we eat. Good food, quality food, because what we put in our body affects what our body processes, and also what comes from us in terms of diseases. So healthy eating is the first place to go. Healthy eating doesn't have to be too expensive. Healthy eating just can be eliminating some of the bad things that we don't need. And I always give this to some of my patients, that, okay, nobody needs pap or juice or too much alcohol and stuff like that. Everybody needs water. So just by replacing the juice and the pap with water, that goes a long way to help in so many ways, because pap especially is loaded with sugar, and sugar gets us into so much trouble in terms of weight gain, and then people who become insulin resistant because of the weight gain. quickly start developing pre-diabetes and then working themselves into full-blown diabetes. So the first thing is what we eat. If we can control some of the food that we eat, not indulging in too much of what we call the junk food, the chips, the pap, and things like that, those things will help us a long way to keep ourselves healthy and prevent us from developing certain diseases. And then, secondly, exercise. Exercise is key. It doesn't have to be a gym membership or things like that. One can just walk around the park or get involved in coaching little leagues or riding a bicycle. Or people who can afford it to buy the treadmill and stuff like that at home. Because of how things are now, most of us don't have the time to go outside and do anything anymore. And there are some portable treadmills that one can put in a small space, and as soon as you have some time, you can jump on it and do some exercise. Daily exercise. Exercise goes a long way to help us maintain our good health. And then things become a bit, how do I put it? Because there are some people who are very religious. It's been shown that people who meditate a lot, individually, it helps them. A group, it hasn't been shown to do much for the group. It's been shown to do a lot for the individual. So if you do meditation, that also go, because health is not only the body, the mental health is also very important. Yes. So that is also helpful in terms of maintaining good health. And then having good friends who can listen to you without criticizing you about anything. Granted, we all go through things that at some point you just want somebody to listen to you without criticizing. And so those things are also very important. If you have somebody who will listen to you and tell you, okay, don't worry about it, this one will also come to pass. All those things come into play to make us healthy. And then we can do all those things, but problems may come. If the problems come, that is where the doctors are there for, to help navigate and help solve some of those problems. Some of them, when they are identified and diagnosed early, they can be prevented, or you may not be on too many medications to get yourself in good shape in terms of controlling the disease. Everything in medicine, when it is identified at a later stage, it becomes more difficult, more time consuming, more expensive to be able to control them. So if you put all this together, we can have a healthy community going forward. If we do this, one person doesn't have to do all of them. You can pick one or two things that work very well for you, and then take it up from there.
Absolutely. We've been speaking with Dr. Prince, and he's been giving us a very in-depth information about his practice and how we can all stand to be healthier. We're going to take a short break, and when we come back, we're going to hear from him about the initiative to have a community health clinic. Now that we've heard all the very essential things that a primary care provider does, we also know there are people in the community who do not have insurance or who do not have doctors, and that is where we all come in. Stay tuned. I'm Dr. Araba, and we'll be right back.
Chocolate is the first luxury. It has so many things wrapped up in it. Deliciousness at the moment, childhood memories, and that grind-inducing feeling of getting a reward. Now think about it. Chocolate presented as things you love the most. Yes, and edible too. Try our chocolate shoes, and your love for chocolate will go a notch higher. You will never see chocolate just as a bar. Your imagination will go wild. Go ahead, Take your bite. Kabi.
Kebby.
Looking for that special gift for that special someone? Looking to bring life into your personal or family portraits? Art Bank is your creative bank of art solutions. We provide a wide range of digital photo editing and paintings that will transform your images into exquisite yet affordable pieces of art. We bring old photos back to life. Your photos can be framed or made into canvas prints of any size of your choice. Our ultimate goal is to bring into your homes and offices amazing masterpieces through eye-catching portrait paintings for occasions such as birthdays, graduations, award ceremonies, funerals, and many more. You can locate us on Instagram at @bankgh. You can also contact us on 312-609-9907 or @bankgh@gmail.com for all your inquiries. Art Bank, reviving your images.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us at Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV. Thank you once again for joining us and staying tuned to Health Talks. I'm Dr. Araba, and we've been speaking with Dr. Prince Hodogbey, who is a primary care provider, and he's been giving us a lot of very important information on how to keep ourselves healthy, and more importantly, how we should be seeing our primary care providers at least at a minimum once a year. So we're going to go ahead and talk about the Community Health Clinic. That is an initiative that Ghana National Council together with Ghana House Incorporated is working on, and Dr. Prince is the medical director for that program and the lead. And so he's going to be telling us about its mission and how important it is. And I want for everyone to really pay attention. If you have not yet shared the feed, please share the feed because this is very valuable information. Even if you think it can't help you, it can help somebody else. Remember that Health Talks is brought to us proudly by Trend Africa TV and Ghana National Council. We also truly thank our sponsors, the Jemima Nunu Foundation, Omama TV, Holiday Africa, and PA Ventures. So Dr. Hodogbey, go ahead and tell us about the mission and tell us a little bit about when this whole thing began. I know that people have seen in the community, and my producer had some pictures up a little while ago, and we've been doing health fairs, but how did this whole idea come about where we need to just extend it a little bit further and have a clinic?
All right, thank you, Dr. Cromwell. This is not new, and I'm happy I'm talking to you about this because you actually got me into it before we are trying to advance it to and move it to a different level. Yes, this has been going on, being organized by the Ghana National Council for some time now. I think many years ago, you may be able to help me. The first one that we did, and then I think yearly after that, and sometimes twice a year after that, until COVID came in and everything got distorted. I think we did some virtually, but it's not new to the community. It has been in the community. for some time now, and people have participated in it. We have good reviews from some of the participants who took advantage of the program in the past. How it became the community health clinic, which is at its infancy stage now, is long story short. A committee was put together that evolved into a board to find ways to buy Ghana House, and we have known that we have been trying to get Ghana House, a place that Ghanaians can converge to have activities, and we display our culture, and hopefully have people learn about us. That idea has been there for a long time, and we have tried several times and failed not to get a place. So about 3 or so years ago, if I'm not mistaken, a group of people were put together to find ways for us to acquire Ghana House. And then I became part of that committee later on. They started before I was co-opted in at some point. And then we started working and going through things, having experts talk to us as to what we need to do to be able to get Ghana House going. And then one of the things came in that we, even if we have the Ghana House, it may be a good idea to have a community health clinic incorporated into to the Ghana House. So that was when the idea was born. This particular one was born, and we had then we had about 3 physicians on the board. One of them is not with us, and now she's not participating. She's not on the board anymore, but she's willing to participate. So 2 of us are there. So we quickly from the board brought you, Dr. Cromwell, in, and also Dr. Ofori, a pharmacist, and Ms. Habiba Fuseni, and also Krista Amo, who are forming the core of what we want to do now. We do not want to digress too much or move away from what we were doing in the community before in terms of the Community Health and Wellness Expo. So we want to work that into it, revive that, and now be more punctual in terms of doing it more frequently every month. So that is where the idea. I'm sure there are other follow-up questions, so I don't want to take too much and answer those questions before they come in. I'm sure you know as well as you and I are working on this. So that is where the idea came in, and it shouldn't be anything new to the community. It is something that the Ghana House and Incorporated, and in conjunction with Ghana National Council, are trying to put together. And the people I mentioned are not the only people. We actually encourage more volunteers who are in the health field to come and join us to do this for our community. So I'm sorry I gave too long an answer to a very short.
No, that's great. And for anyone, as Dr. Prince said, for anyone who was able to come to any of our Health and Wellness Expo, you can testify that it's very organized, and we've always had the community's health, at the heart of everything that we've been doing. So it's exciting to see it growing into something that we'll be doing more frequently. As Dr. Prince said, we were doing it like maybe twice a year, and then with COVID, we did one virtual. But of course, healthcare needs to be face-to-face. Telemedicine has its part to it, but we need to be able to see our people. So we're happy to be able to get back and do that. So we know that this is a very good initiative, but what are our overall goals? What do we want the community to know? The goal of the community health clinic.
Our endpoint, I'll start from the end and maybe work my way back or come to the middle and go to the beginning, but that's a joke. Our endpoint is to be able to establish a federally qualified health clinic for the Ghanaian community. Those of you who are aware of clinics as such, those are clinics that operate from minimal or low fees depending on income, all the way to people who can come there with insurance. We know our community here, we are immigrants that move here, so the challenges that every immigrant group faces, we also face as Ghanaians. So our goal is to eventually establish a health clinic, community health clinic, for people who, for some reason or another, cannot afford to go to see a physician on a regular basis to have their health problems taken care of. So that is the goal. That is where we want to get to. As I said, we are at the infancy stage now. We have to learn to crawl before we can walk and run. So we are going to work gradually towards that goal. Eventually, hopefully, within a year or two, we may be getting to that point if all things work well.
And I think the very important part that you mentioned here is that since we will be doing this monthly, we spoke a little bit earlier. For anyone who did not hear, Dr. Hodogbey said that you should be seeing a provider at least once a year, or if you have other issues, they need to be monitored more closely. So by us having this once a month, it really gives the providers a chance to really follow up, especially for those people who do not have primary care providers. So I just want to make that very clear that there's no limit to how many times you can come. If you were to come maybe in November and you had high blood pressure and one of the doctors gave you some medication, we would not only check on you in about a week or two, but we would expect for you to come back the next month so we can make sure everything is okay and adjust medication and do things. So this is a very, very long-term solution to making sure that our community is as healthy as possible. We know that the Ghanaian community is a very close community, and we know that unfortunately sometimes we have a lot of tragedy in the community. So I feel like this is a good solution to limit some of the tragedy, and we can also stop some of the premature deaths, especially related to what Dr. Prince was telling us about hypertension and diabetes. These are all things that, if monitored correctly, we can be able to help in the early stages. So very, very exciting. So we know that we are living in very, very difficult times. So again, why is it so essential for us to be able to provide this free service? We did it twice a year for free, but why have you and everybody who brought this initiative out want us to do it for free monthly? Why is it important for us to still be able to do this for free?
For so many reasons. The first one is what you have also spoken about. We are an immigrant community, and people come in and people unfortunately move out, either move back home or pass away. As an immigrant community, there are problems because even no matter how established you are before you come to another place, one is not going to be able to have all the necessary documents to be able to have health insurance or things of that sort to begin assessing the system the way it is established here. Therefore, having a free clinic here will help a lot of people who, for example, somebody comes in who is on medication in Ghana, came in and person cannot have any access to any place to get that medication refilled. That is a service that we can provide to that person from our community without a fee, and then we move forward from there. Eventually, we live in a country, even where we come from. Eventually, we need money to do everything. So if things are going well and people are established and they are employed and they want to donate to us, we will take those at the beginning. Eventually, the goal is to get into the FQAC, the Federally Qualified Health Clinic operational method, whereby your whatever you pay depends on your income. If you don't have any income, obviously you cannot pay anything. If you have enough income and we are providing a good service to you, you may be able to help us to keep the program going. So the reason why it is important to start free for now is to get the community involved, to let the community also know that we exist and we provide these services. And then as we grow and as things get established, we can decide what else we need to do to keep us viable, the health clinic viable, at the same time be able to serve the community in a good way.
Absolutely. And we are just looking at the same time as you're talking, we're looking at some footage that was from our last live one. And, Dr. Prince, you've been with us from the very, very beginning. How have you seen the progress and the growth of the, every time I see it, I'm just so excited. We have just come so far. So tell our audience a little bit about how we've grown from the first time we had it. I believe it was 2018 until even our last one before COVID. How do you see the progress and how much have we added, like the value we've added to the community?
Anytime I talk about this program, I blush because we have come a long way, but the satisfaction from a healthcare provider is seeing their patients doing well. I will tell you a short story. Maybe my stories are never short, but I'll make it short. I'll tell you a short story. When we had one of those events, I don't know which one it was, and there was one attendant who had some difficult issues. The blood sugar and things were way high. So you know the story, but the audience have to know the story too. So we took care of that kind of in a quasi way because we're not fully established to handle it clearly, but we gave enough advice to that patient to take care of things. And one of my happiest moments about the Community Health and Health Expo that is evolving into the Community Health Clinic now. And we went to a function. There was a function, I think it's either a funeral or something. And then I walked into the lady. I didn't even know. I didn't identify her. And she walked to me. Doctor, I took all the advice. I went to do this and my sugar is very controlled now. I couldn't be happier than that. I was so happy to see somebody like that who from this, she got to get the information and work on it. And she was happy for herself. And I was very, very, very happy for her. So that is the satisfaction that comes from doing things like this. Yes, it is time consuming, and in our field, there's no time to do anything. But if we devote some of this time to helping our people, there's no greater satisfaction that comes from that than seeing somebody who, with that blood sugar, I cannot predict bad things, but with that kind of blood sugar, if we were not to control that, within a month, that person might have gotten into diabetic coma, and the outcome may not be good for us. Yes. So that is where we came from, and stories like that should be what we should be working towards.
I agree completely. And that's what makes me so happy that we're going to be able to extend this service just full force monthly. And let me just take this time to really thank our volunteers. We have amazing volunteers, nurses, pharmacists, nutritionists. Just so many people from the community that volunteer, and they provide us with stuff to be able to treat people. So it's really, really the effort of everybody. So it's very important to just acknowledge all those people. I know some of them will be watching, and even if we can't name your names one by one, you know who you are, you're on the platform, and you are very valuable, and we truly, truly, truly appreciate you. So we talked about what beneficiaries out there are saying about the expo. And so now that we're getting to the clinic portion, is this process going to still be walk-in? Are we going to require for people to have appointments? Let's talk about what the structure is so people know what to expect when they get there.
Yes, initially the structure is our first event is going to be on November 13th, the second Saturday of November, and we hope to be holding it the second Saturday of every month for now. So yes, the first few events is going to be walk-in, but as people walk in, we will be taking, we'll be building our database, and then having the health metrics in terms of blood pressure and sugar and those things that we can measure. If we identify a problem is not working anymore, then that becomes a schedule. Some of us can volunteer our time to work outside the established once a month system to be able to help people who needed help. And that's exactly the example that I just mentioned. So initially, it's going to be working. As we get bigger and get older in terms of doing this, it will become a schedule because sometimes the numbers and the problems may be such that walk-in may not help us.
Okay.
But for now, for the first few months, it's going to be walk-in. But if we identify problems that we need to be following up on in terms of scheduling, we will do that.
So our plan is to have a walk-in method with a little bit of a telemedicine component because, as Dr. Prince said, if there's things that need to be handled before the month ends, we just can't wait for the month to end to, see you next month. So then there will be a component where there'll be maybe a telemedicine portion. You could probably set up a virtual visit where we could be able to still connect with you. And I'm saying all these details because I want everyone who's watching to understand that this is going to be a very valuable service to the community. So again, even if you feel like you're established, you have your own doctor, there are many, many, many people in the community, and Dr. Prince can be, very attest to this very well, that contact a lot of the providers privately and they are helped, which is no problem. But the proper way how we can be able to really help you and make sure that your health is the best is to be attending these monthly visits to get yourself registered so we can be able to check on you so nothing nothing falls into the crack. So please, please, please make sure that you share this information with everybody. So in terms of our goals, so now we're talking maybe 1-2 years of doing it free. And you talked about us turning into a bigger clinic, a federal qualified clinic. And so once we get to that level, what are our plans? Do we have any plans for expansion? Where do we see this long term? Because healthcare is always going to be something that's going to be valued in the community, whether, no matter whether we leave or if we move somewhere else. This is a permanent solution for the Ghanaian community in Chicago and other nationalities who will be joining us. So what is our long-term goal for this?
Our long-term goal, I mentioned briefly, is to establish a clinic. That is the long-term goal. And that clinic hopefully will be in the Ghana house that we envision. And then if we become bigger, because the Chicago area is very expansive, the community is large. So if the patient population to that clinic alone, depending on where it is located, if that patient population becomes large, and we also see that people are traveling too far, because at that point it's not going to be walking anymore. We will have walk-in components to it, but we'll have established patients at that time as well.
Right.
If we realize that people are driving several miles, maybe from the north side all the way to the south side, or vice versa, or to the suburbs, depending on where we are, to be providing services, then we can open another clinic, and not necessarily in the Ghana house. We are going to have only one Ghana house, but we don't have to have one clinic.
Right.
Depending on patronage and participation, we can have additional clinic, and depending on how well we are doing, that's how every healthcare system expands. It depends on need and depends on participation. So if the need is there for us to provide services and we are established, there's no limit to how many clinics we can have. We can have clinics at the north side, in the middle, at the south side, the south suburbs, the west suburbs, maybe northern suburbs, where our people live, we can serve them. Even though we are calling this a Ghanaian community health clinic, if we open our door and people walk in, we are not going to turn them away. Exactly. They can come from other communities and we have to serve them. So if we are doing well, we are going to be serving more people, not only Ghanaians, but people from outside also. So that is the long-term goal. But our medium-term goal is to be able to establish a clinic where Ghanaians can walk into and have good service. And then after that, if the patronage is good and the numbers are good, we will expand. Our expansion depends on how much people are coming in and how much our services are required.
Very, very important. And expansion, of course, will happen just as Dr. Prince said. And we are hoping that the community will really take advantage of it. One thing that you said is very important, that even though the plan is, of course, looking for the Ghanaian people, when you think about it, there's lots of races that go to like the Asian health services. Just because it's named something, does that mean that's the only culture that it serves? However, we do know that since we do live in a community where some of us do not have the information or the access, we do want to make sure that the people in the community are utilizing this the most. And then, of course, our doors are completely open and we would want to help everybody. We're going to take a quick break. When we come back, we're going to hear from Dr. Ofori. Dr. Ofori is a pharmacist who's also on the board with the health clinic, but he's going to be giving us some updates about COVID-19. We know right now that a lot of people have a lot of questions about the booster, when they can get it, when they shouldn't get it, how safe it is. So he's going to be giving us that presentation when we get back. I'm Dr. Araba. This is Health Talks, and we'll be right back. Stay tuned.
Looking for that special gift for that special someone? Looking to bring life into your personal or family portraits? Bank is your creative bank of art solutions. We provide a wide range of digital photo editing and paintings that will transform your images into exquisite yet affordable pieces of art. We bring old photos back to life. Your photos can be framed or made into canvas prints of any size of your choice. Our ultimate goal is to bring into your homes and offices amazing masterpieces through eye-catching portrait paintings for occasions such as birthdays, graduations, award ceremonies, funerals, and many more. You can locate us on Instagram at @bankgh. You can also contact us on 312-609-9907 or @bankgh@gmail.com for all your inquiries. At Bank, reviving your images.
Chocolate is the first luxury. It has so many things wrapped up in it. Deliciousness at the moment, childhood memories, and that grind-inducing feeling of getting a reward. Now think about it. Chocolate presented as things you love the most. Yes, and edible too. Try our chocolate shoes and your love for chocolate will go a notch higher. You will never see chocolate just as a bar. Your imagination will go wild. Go ahead, take a bite. Kabi.
Check out this beautifully made artistry of coffee tables made from a combination of recycled tires, jute ropes, wood, and fabric to suit your style. Yes, we make to order. These coffee tables can help you make a statement in your bedrooms, offices, and living rooms. But remember, we only ship within the USA and Canada after shipping cost is paid. Call Jasper Designs on 1-306-203-2650 or email us at doduyayra@gmail.com. Follow us on Instagram at Jasper Love or follow Pearl Yara Agboka on Facebook. Don't be left out. Please place your orders now.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for staying tuned with us. We've been speaking to Dr. Prince just about a lot of different things and pertaining to the community health clinic. For anyone who has just joined us, don't worry, you can always go back and watch the entire program so you can be able to understand that everything we're talking about. But we've reached a point where we need to hear some updates regarding COVID 19. So at this point, I'd like to bring on Dr. Ofori. Dr. Ofori always sits on the professional panel with us, and so he's going to be giving us a some synopsis of what's going on with COVID-19. So, Dr. Ofori, the floor is all yours. Thank you.
Very much, and thanks to Dr. Hodogbey for his time and coming on this show to explain to the listeners about the community health clinic that we want to establish in Chicago. So I'm just going to give an update about what is going on in the COVID world in the numbers and in terms of vaccination efforts, and also what are some of the recommendations that the CDC is giving in regards to the booster shots. So currently, we know that around the world, we are almost about 5 million people that have died from this pandemic, with over 240 million people having the virus around the world. And as you can see in the US, the numbers seem to have gone down. And actually, around the whole world, there's at least 10% drop in number of cases. And in some cases, too, we do know that number of hospitalizations and deaths have also reduced drastically. This could be attributed to a lot of, I would say, like a lot of factors, which includes the fact that a lot of people are either vaccinated, especially in the countries that are driving the numbers, such as the United States, UK, and so forth. So if you look at the data, like I mentioned, US, the numbers are really low compared to where we were like early this year, relatively speaking. Now, if you look at around the world as well, we do know that as we speak, the places that we can think of, like South Americans, the Asian areas tend to be the drivers a lot of the numbers, and especially Americas as well. So we tend to focus on these countries. And when you zoom in into US, you realize that places like Pennsylvania are picking up in numbers as well. But you realize that places like New York, that used to drive a lot of cases and death rates in the US, tend to record very low numbers of deaths as well. But it seems like something that is good. We are going in a good trajectory, but we still see that there's some, a huge number of people that are dying from the COVID-19, and most of them, I understand, are unvaccinated. So that goes to tell you that if you're listening and you haven't gotten vaccinated, if you have the opportunity to, please, we entreat you to do so. Especially if you go to Illinois, like today alone, we have 51 deaths. It's not a joke. And most of these people, out of the 51 deaths, over 95% of them are unvaccinated. If you go zoom into Africa, you can see the distribution of cases around Africa and the number of deaths that we're seeing in Africa. We still don't have significant number of people dying in Africa, mostly because a lot of the countries, the age limit and other factors contribute to it. Even though we do not see observance of, the 6 feet social distancing and wearing of masks, especially in my home country, Ghana, we still don't see a corresponding increase in numbers as we see in the US and other countries. We don't see a corresponding increase in hospitalization and deaths as well. But it doesn't mean that we shouldn't observe or get vaccinated if you do have the opportunity to do so in Africa. Namibia tends to be one of the countries where they're struggling a lot in number of cases as well. Ghana at this point stands about over 1,000 deaths, 1,158 deaths, which is a lot in my opinion. And we still have, a lot of cases at this point, almost close to 130,000 cases in Ghana as of now. If you look critically at the data that's supplied by the Ghana Health Services, you can see that the trend is going downwards, which is a good thing. We don't have like major peaks as you see in the US, but however, you do see that there's a drop in number of cases. I've already highlighted that around the world, the number of cases of COVID is reducing as well, and it's not surprising that you see that in Ghana. Now, let me take your attention and go to Kotoka International Airport. That is where a lot of people are coming into the country. You do see that there's a number of cases, over almost close to 3,000 cases so far since the pandemic started. We've recorded close to about 3,000 cases coming into the country, which kind of raises some, some red flags when it comes to people that are traveling to Ghana. You're expected to get a negative PCR test in 72 hours prior to traveling to Ghana. Now, again, this is just a data that is showing you the trajectory that I already told you about. The 7-day average, is kind of going down, which is good in a sense that the more cases you have, the higher the chances that you're going to have people dying from COVID-19. It doesn't mean nobody's dying, but then it means the numbers are relatively lower. Same thing is highlighted in this item. Now, if you look at the different regions we have in Ghana, you can definitely see the areas that are driving the numbers, mostly Ashanti region, Greater Accra region, and places like Western region as well. So we do see that people who are traveling to the country, as already mentioned, about 96% of them actually recovered. About 108 of them were active cases that were caught at Kotoka International Airport. But you can clearly see that Greater Accra region is actually driving most of the active cases. So that takes us to the world of vaccination. At this point, 48% of the world population has received at least one dose of the vaccine, which is good news. 6.6, close to 6.6 billion doses have been administered. You ask yourself what area you live in and what proportion of the people are vaccinated. That can easily be found at the CDC website at this point. Only 2.5% of people in low-income countries have been vaccinated, which really kind of homes in the fact that we need to treat this whole pandemic as a global issue instead of people taking, instead of states or countries taking it upon themselves, because these viruses do not know boundaries. Now, if you look closely to like number of people that are vaccinated, from a bird eye view, you can clearly see that the US and South America and some parts of Asia tend to be, and especially Europe, tend to be leading in number of vaccines that are received. If I do zoom in to the United States alone, we do see about 65% of the population that are vaccinated, at least, or have received at least one dose of the vaccine at this point, corresponding to 187 million people. If you look at the numbers this way, it's very encouraging, right? Now, you can see that the number of vaccines that are administered starts to dip. I think around July, it hasn't picked up since then. Going back to the fact that a lot of people are hesitant to get a vaccine, there's been a lot of policies that have been enacted to ensure that people get vaccinated, especially coming from the federal government in the US. Now, if you look at the demographics of, I would say, the ethnicities, you can clearly see that Blacks and Asians and even Hispanics tend to be lacking in terms of the percentage of people that are vaccinated in the past 14 days. So we still need our people to get vaccinated, especially Ghanaians in the Chicagoland. Anecdotal data tells us that a lot of people still don't have the vaccine shot. And again, going back to the health fair that we're going to talk about later on, we want to encourage people to actually go ahead and get a vaccine if they do have the opportunity to do so. Now, in the good news is that just this afternoon, this evening, the FDA panel unanimously recommended the COVID-19 vaccine from Moderna. They recommended the booster shot for at-risk adults. This is good news because a lot of people, about almost, I would say 80 million people in the US actually took the Moderna vaccine, and they are waiting to hear from the FDA and ultimately from the CDC to clear that the Moderna vaccines can actually be given as a booster shot as well. In another news, in more or less an African direction, which is great in the sense that Biden and his administration are trying to help efforts in combating COVID-19 in Africa, leading us to about 70 million doses that have been proposed to be given to Kenya at this point. Ghana has received some vaccines from US as well that are currently helping with the vaccination efforts in that direction. Again, if you zoom into our dear motherland country, Ghana, we do see that the percentage of people vaccinated is very low. As currently we look at 1.37 million people that are at least receive one dose of the vaccine at this point. We're still behind the targeted 20% that was set out by the WHO for countries like Ghana and low-income countries. Now, if you go to the CDC recommendations for COVID-19 booster shots, it actually targets people who are 65 years and older, 18 years and plus who work in long-term care facilities, anyone who is 18 plus and who has underlying medical conditions, and those who are at risk, or live with people who are at risk. So it's a very broad list of people, which basically who can get the Pfizer BioNTech vaccine, which has been approved for booster shots. But as I wrap up, what I'm going to say is that it's very important that if you do have an option to get a vaccine, you should go ahead and do it, because the data is very strong in the sense that those who are dying from the COVID at this point are mostly unvaccinated. So I'll pause here. If you have any questions, you can ask me.
Thank you, Dr. Afori. One question that I did have was pertaining to the booster shot. Today, when I was watching the news, they were saying that people who had the Johnson & Johnson vaccine, it would be okay for them to go ahead and get a booster shot, even though I believe the only booster shot available is with Pfizer. So what recommendations do you have for people, and who are the people that should be looking out to get the booster at this point?
So the last meeting that the CDC panel advisory board on reviewing vaccines had for Pfizer and BioNTech vaccine before its approval recommended not to mix these vaccines. If you had Pfizer, if you had a Pfizer vaccine or Moderna or the J&J, you should have a booster from that same company. There's not enough data to support mixing these vaccines. However, anyone who has had the vaccine in the past 6 months, right, and qualifies under all the lists that I gave, might be able to get a booster shot from the Pfizer if they did have the Pfizer for the first 2 shots at this point. The Pfizer also stated that they have enough supply to give to all the people, the millions of people who took the Pfizer vaccine this week.
Okay. And so here in the United, and I know it's different in Ghana, but here in the United States, we do not have a shortage of vaccines, right?
Yes.
Right. We don't.
We don't. Yes, we don't have a shortage. Yes.
Because I also I was watching some TV and some people were saying that many people have not got vaccinated, but yet we are pushing the booster. So the people who have not got vaccinated is more just by choice, but not because we are out of vaccines.
Correct. So we do have enough supply. Actually, I just indicated that the US is giving supplies to other countries at this point. We do have enough to go around even 3 times. So it's just a matter of convincing people to get vaccinated. Those who need more data, in my opinion, the data is very clear at this point that, those who are dying from the infection are actually unvaccinated. There's no data that beats that at this point.
And so how close are we also for the children? I know that last time we spoke, they were working on children, I believe, at the age of 5 to 12 would be from children's. So how close are we to that?
So for children 5 to 11 years, currently all the 3 vaccines that are approved in the US are working towards getting vaccines for children 5 to 11 years, right? And one of the things is that on October 26th, actually, the data that was provided by Pfizer to the FDA is going to be reviewed. And if it shows that indeed it's active or effective and also safe, then they're going to recommend the CDC to look into the data and have the advisory board approve it at this point. So we're still about some few weeks away from that happening. And all fingers crossed, the data that was supplied to the FDA was very compelling. And in a very, very short future, we're going to have vaccines approved for children. The only concern I have is that it will be up to parents. It will be up to, it will be a lot of, education that has to go around to convince a lot of parents to get children vaccinated. But as I speak, those age 12 to, I believe, 18, we have more than at least almost close to 40 million of them are vaccinated in the US.
Vaccinated. Okay.
So that is good in one direction. But we still think that when we approve those from 5 to 11, there's still going to be a lot of you know education to be done in order to convince parents to have their kids get vaccinated at this point.
Okay. And as Dr. Ofori said a little bit earlier when he was speaking, is he definitely is part of the Community Health Clinic and has been helping out with the Community Health and Wellness Expo. Let me just introduce him well. Dr. Ofori is an assistant professor of pharmaceutical sciences of Chicago State University. He's a pharmacist by training, and his research focuses on drug discovery of neuropsychiatric disorders, including schizophrenia, depression, and substance abuse. So, Dr. Ofori, I just want you to tell everyone that's watching, what is your role in terms of the clinic? Because we know that you are a pharmacist, we know that you are an educator. So just tell them what your goal is for the clinic and what you intend to be doing along with your team. Because I know you always come with the Ghana Pharmacy Association, which has been extremely helpful from the onset of the expo. But tell the viewers who are watching what your position is with the clinic.
Great. So as you rightly said, we are very excited about this particular project. Myself, you, and Dr. Hodogbey, we are trying to, and other members of the team, we are trying to put this whole vision into reality, which basically will serve a lot of people's health needs, right? My role on this particular project is to provide a means to get good pharmaceutical care to some of the patients and the Ghanaian community when this clinic comes into fruition. Also, as an educator, I'm going to try and serve on this panel to provide my input in terms of training, which is one component of the whole goal, is to actually have a training center for like CNAs and LPNs and pharmacy techs and a whole lot of skilled people that are going to help in that regard for the community and also with the clinic as well. We're going to work closely with everybody in the community to educate, which is very important. Direct people to these resources, because it will be of no use if you put all these great ideas together and people don't even know about it. So we're going to start promoting this place when eventually it comes into fruition. Also, with our healthcare outreach, we're going to continue to do that. There's going to be a health expo coming up very soon. We're going to declare or tell you guys the exact time and date. We expect people to show up, patronize some of the things we're doing, because your health is your wealth, right? So we want to make sure that every Ghanaian in the Chicagoland area has access to basic health needs, as sometimes this is usually hard for some people to find.
Excellent. And I know that one thing we always advertise is brown bag service and just pharmacy consultations. So for people who do not know what that is, Dr. Ofori, can you tell our viewers why it's important to bring all your medications when you're coming to the health clinic, and any questions that they may have so you can be able to help them?
Right. So we call it a brown bag review, right? So it's basically bringing all your medicines so that we can reconcile them. We can, in a layperson's term, make sure that you're taking them right, and some of the side effects to be expected, and basically review it for you. So every drug can potentially help you, can also be a toxic, right? It can be something that can potentially harm you. So sometimes it's very important that you have a pharmacist or a clinician who is knowledgeable to be able to kind of bring all the medicines together for you. And if there is a need or there's a recommendation that we increase some of the medicines doses, we will talk to your physician and also do that as well. Or in some cases, to reduce some of the doses, we do that as well. So these are some of the services that the Ghana Pharmacists Association will be providing in during a health expo, and in the future, when you do come to the clinic, we will try to supply or provide this kind of services to you as well.
Excellent. So I just want everyone to see how comprehensive this is, and it's very exciting for us all. For anyone who has been to the expo before, just know that this is going to be the expo, but every month. So things are going to be monitored very well. And as Dr. Prince spoke, who is the medical director and the lead on this program, he's very knowledgeable on disease management. So these are things that is going to be, you should just really look at this as something that's going to really, really benefit everybody. And it's a legacy that we are all leaving. A lot of people know or don't know that Dr. Hodogbey was also my mentor and also my preceptor when I first got into my program. And so you can know that I'm qualified because I was taught by a very qualified doctor. So please and please and please make sure that you're patronizing. We're going to take a quick break. And when we come back, we're going to get into some of the other services that we're going to be providing at the clinic. And we'll open our phone lines up for any questions or concerns. I'm Dr. Araba, and we'll be right back.
Welcome to sankofaonline.com. Your number one diaspora news portal has joined with GhanaWeb.com to bring to you the latest news around the world, especially Ghana. Visit our website at www.sankofaonline.com, or you can download our app from the Google Play Store or App Store. Sankofa Online, serving the Ghanaian Chicago community.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for staying tuned. I'm Dr. Araba, and this is Health Talks. As we spoke earlier about the health clinic, we are now going to get into all the different services that will be offered on that day. So I'd like to bring back Dr. Prince, who is going to tell us the services that we should be able to expect to see that day. Dr. Prince?
Yes, Dr. Cromwell, thank you for bringing me back. And thanks to Dr. Ofori for that succinct presentation and updating us on the COVID vaccines. Yes, our services will include the common diseases that I mentioned before: hypertension, diabetes, high cholesterol, asthma, some skin diseases, the simple and common ones that we can handle easily, and women health. We have Dr. Oko, who is an OB/GYN on our committee, and she's actually our vice chairman for the committee. So she will be handling the women health part of what we intend to do. Nutritional counseling is also going to be available, and mental health issues, the simple ones, the complicated ones, we will try to identify some mental health providers that we can send people to if they are very complicated. The simple ones, we can handle that between we the providers on the committee, and also travel medicine, and then pharmacy. You have already heard Dr. Ofori spoke at length about the pharmacy things, and this is not new to us. Those of us that we are listening to, from Dr. Cromwell to Dr. Ofori to me, this is not new to us. We have been doing this, and Dr. Ofori has been providing these services to the community for a long time already. So it's something that we are just picking up from where we left off and then going forward from there. So those are some of the services that we'll be providing. Anything outside that we can handle, we will be able to do that. If we cannot handle it, we will try to identify other providers in the community that can help us. We are not only going to limit ourselves to providers in our community. If we need services that we can have other organizations that have that are more established. We are an infant now, so we have to follow on sister organizations that are more established to help us solve some of our problems. So if we can identify some of those organizations and we have cases that we cannot handle, those will be channeled to those organizations to help us.
Okay. And one question that came in, will we be able to prescribe medications? And what if people don't have insurance? How do they go about getting their prescriptions?
The answer to that is yes. Between myself and Dr. Ofori, we'll try to figure something out to see how best we can help the people. The prescription writing, that is an easy thing for me. Dr. Ofori will have the other part of the work to see if we can have maybe some samples to give patients who do not have the insurance. But some of the medication, actually most of the medications for treating the common diseases are not too expensive. If somebody can talk on the phone and pay a monthly phone bill, that person should be able to, should have programs for that person should to be able to get some of those medications to treat some of the common diseases. So those affordability of the prescription and should not and other things should not be a barrier to anybody coming to us. We have been practicing in the area for some time now, so there are other resources that we don't have that we can fall on to help people who have needs.
Okay. And Dr. Ofori, can you tell us a little bit about how people can get prescription help if they don't have insurance?
Absolutely. So there are programs that actually can help individuals who don't have insurance to cover their medication. We do have a list which we can provide to our listeners in due time. At the same time, you do have like discounts like that you can also look up certain codes that will help you reduce your prescription cost drastically, up to like 80% in most cases. So, like you mentioned, most of the drugs are not expensive anyways, and we can actually find you some kind of codes to reduce your drug cost tremendously.
Okay. And I know that we also mentioned, just because of the type of season that we're in right now, COVID-19 screening and immunizations. Are those both things that we would like to still implement in the clinic? And if so, what do people need to know about coming to get those tests done? Screening and the immunization.
Yes, that's one thing that I forgot to mention. COVID-19 screening. The screening tests are all over the place, so that should not be a problem for anybody who wants to get those tests done. And the vaccinations are also there. There's a lot of misinformation in our community and in the community at large, in the Chicago area, not only Chicago area, in the whole world, uh, as to the COVID vaccine and what it doesn't do. There's no day that I go to the clinic without finding a patient with misconception and why they shouldn't get the vaccine. Even today, two patients, I had to spend a lot of time educating them on why the source of their information was wrong and it shouldn't be that way. So yes, we are going to be screening for people who are not yet vaccinated, and try to answer their questions as to what is holding them back. In this country, you shouldn't be, because as Dr. Ofori said, about 95 to 99% of the people who are dying from COVID now are the people who do not have the vaccination, and there should be no reason why. This vaccine has been around since the later part of last year, and it wasn't available to everybody at that time, but now it's available to everybody. So there's no reason why that should be there should be a hindrance or resistance to getting vaccinated. If people need information, they can contact me, they can contact Dr. Ofori, they can contact you, the host, Dr. Cromwell, to have their questions answered and get themselves vaccinated. The flu shot, yeah, it has been around for a long time. So, but the problem of COVID vaccine resistance didn't start from COVID vaccine. The people have been resisting the flu shot for a long time, even though we've been doing it for on annual basis. But that is there. We are planning to provide that as part of our services, and also educate the younger kids, especially from birth to age 4, about some of the vaccines that they also need to get.
Excellent. Thank you very much. So it's 8:17 now, so I'd like to give the chance for both of you guys to give your closing remarks. So we'll start with Dr. Prince, your closing remarks for this evening.
Yes, thank you to the audience, and thank you to Dr. Akromo for having me on the panel. You have tried several times to get me onto the panel, but this one I don't have a choice to say no. So thank you for having me, and to our listeners, this is something we are trying to do in our community to advance the health and wellness of our people. But I always tell people there's no doctor without a patient. You cannot be a doctor if you don't have a patient. So we need you, the people in the Chicago area, or people who are listening who are from outside. If you come in and you have any needs, you can approach us, and we'll try to help in that regard. This is something that we will need the help of everybody, especially our healthcare providers in the area, to chip in so that we can do it and do it well. There are going to be challenges. There's no doubt about that. I don't go into anything naively thinking that things are going to be easy. That is not how life is. Even the easiest thing that one thinks about, as soon as you move from the concept on paper and then getting into doing it, you really start to see problems. We envision and to have problems, but with the caliber of people we have and the community that we serve, we know our community is difficult. But our health is our wealth. If we are not healthy, we cannot do anything. And I always tell people, some people ask me, why do you devote all this much time to these things? Your colleagues are this. I said, no, it is better than going to a funeral. So let's all come together. Let's work together and move our community forward in health. Thank you so much. Thanks for listening.
Thank you very, very much, Dr. Prince, for joining us. We really appreciate all your time that you spent talking about the Community Health Clinic. Remember that if anyone has any questions or concerns, Dr. Prince can be reached and he'd be more than happy to answer your questions. So once again, thank you for joining us. Dr. Ofori, your closing remarks, please.
All right, so thanks to everyone that tuned in today. Thank you, Dr. Cromwell. Thank you, Dr. Hodogbey, for your time and talking to our audience today about the vision that we have about, providing health services to people in Chicago. I'd like to say that as you're out there, if you're not vaccinated, I will entreat you to get a COVID vaccine at this point, because a lot of people who are dying from the disease are actually unvaccinated. I also entreat you to, tune in and expect that our team, which is the health outreach team, will come out with some information about when we're going to have this outreach program. A lot of things are going to be offered, which will be beneficial to the Kenyan community in Chicago. So therefore, we entreat a lot of you to patronize it and take advantage of it. And also in the future, when we do come out with a community clinic, we expect you to also patronize it and take full advantage of it, because it's here to help the community. So thank you all for listening, and thank you for tuning in next week.
Thank you very much, Dr. Ofori. We're going to go ahead and take a quick break. When we come back, we'll take a few of our community announcements, and then we'll wrap up the show for this evening. Thank you once again for watching. I'm Dr. Araba, and we'll be right back.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
We're going to go ahead and take some of our community announcements. So let's see what we have. I know, let's see when it loads up. First and foremost, you can always promote your business through Ghana National Council on their website and all their social media pages. We do have yearly rates, so if you have any questions and you want to promote your business, I can be reached at 773-526-9493, and we'll be able to promote your business on the Ghana National Council website and all social media pages. We do have a partnership with the Tree Learning Center. So if you have anyone that would like to learn the language or is going to be traveling to Ghana, they are giving a 10% discount for people who are going to be taking Tree and Fanti classes. You'll need to use the discount code TLC-GNC-21 to be able to receive your 10% discount, but it is available and classes are open. They have group sessions or one-on-one sessions. So take advantage and learn the language. There is an initiative that is going on at the Cape Coast Training Hospital. They are giving free cataract surgeries. We've been announcing it since the 11th on our platforms. Tomorrow is the last day. So if you do know anyone who is back home that is having problems with their eyes and needs to have cataract surgery, this is a great time for them to get evaluated and also be able to have their surgery. This is again brought to us by the Cape Coast Training Hospital, and they've joined an initiative to cure blindness. So if you know anyone who has this issue, please share this information as tomorrow is the last day. Trend Africa TV is also able to take care of all your media needs. If you need someone to stream your live event, they are able to do that. They take care of websites, flyers, just a number of things. Anything that you can think about that has to do with media, you can definitely contact us at Trend Africa and we'll be able to take care of that for you. Fleary Health Insurance is a marketplace that provides health insurance for our loved ones back home. So you know that if you have someone who is living back home and they need health insurance, this is the best and accurate way to get it for them. You give your loved ones back home in Africa the gift of a better life. They have lots of different plans that can work for you. They include doctor's consultations, dental, optical, lab testing, and prescription delivery. If you need more information, please visit them today at www.joinfleary.com. Ghana National Council was nominated for an award, the CSR Event of the Year, which we received from our Ghana Fest when we had our virtual concert. Remember that you can still vote. We have until, I believe, the 15th, which is tomorrow, is the last day to vote. So please dial *365*390# hashtag, and you can go ahead and put in our nominee code, which is G43, and follow the prompts. Awards will be given out on the 16th of October. So we are hoping that all of our supporters for Ghana Fest will be able to vote for us so we can get this award. If you need assistance at home and you need someone to talk to, you need a doctor who can come and visit you, the best place to look is Express Med GH. They are located in Accra. You can WhatsApp them for your family members, 054-2053-335 or 020-2660-061. There are doctors available that can come to your home, and they can also just speak to you on the phone about a variety of health issues to eliminate you having to go to the emergency room. So if you have anyone back home that is not feeling well, before going to the emergency room, please check out www.expressmedgh.com. We also have a promotion going on that you will receive 10% off from B Dan Dental. They are a mobile dental clinic that is available in Ghana. If you have any problems with your teeth, they are offering 10% off this month alone. So please make an appointment. They come to you in the comfort of your own home, office. They are very accessible and affordable. You can check them out on Instagram, or you can call for an appointment. 024-894-7951. One of our sponsors, which is Pa Ventures, is also running a promotion in the month of October to receive 15% off on all items that you need for digital painting. That company is Art Bank, Creative Bank of Art Solutions. He can be reached at 312-609-9907. And that concludes our announcements for today. Once again, I'd like to thank everyone for their attentiveness and staying tuned to Health Talks on Trend Africa TV. Remember that Trend Africa TV and Ghana National Council bring us Health Talks every Thursday. We also thank our sponsors, the Jemima Nuni Foundation, Omama TV, Holiday Africa, and Pa Ventures. Establishing public health programs that cater to targeted populations enables public health professionals to improve the quality and care of all communities. To develop effective community health programs, professionals must develop strong competencies in evaluating health environments, understanding local cultures, identifying disparities, strategizing interventions, and creating trusting relationships with people and healthcare officials. Such skills require a high level of dedication and tenacity. That is what the Ghanaian healthcare professionals in Chicago are offering our community and more. So join us in building a healthier community, one clinic day at a time. I end with my favorite quote. Remember, if the sun is not shining on you, let it shine through you. Until next time, I'm your host, Dr. Araba. God bless you, and God bless our homeland, Ghana. Thank you.
Hello there. Welcome to Trend Africa, where we give you the best of live streaming across all states in the US. We also do web designing, event planning, emceeing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.